In this video, we are going to perform waxing of the upper lip. This service should take about 15 minutes. Due to the small area to be waxed and the sensitive nature of the upper lip, we will be using hard wax. It's known to be less irritating, and if removed in the direction of hair growth, it won't distort the hair follicles. Some hard wax products may also contain additives to specifically soothe sensitive skin. Prior to greeting your client, make sure your room is set up properly. Place protective paper at the head of the table. Refer to the full list of implements in your chapter for a helpful checklist. Do you have all of your supplies and implements? Great! Let's meet your client. Conduct your client consultation according to the guidelines provided in our pre-service video. This includes reviewing the client intake form, discussing any contraindications, and sharing any pros and cons of the waxing service. For this service, do not wax the upper lip if your client has any skin lesions, sores, sunburn, or acne in the area. Also refrain if she's recently used exfoliating medications like Retin-A. With your client consultation complete, let's begin the waxing service. Invite your client to be seated in a semi-reclined position. A disposable headband may be used. Drape your client from the neck to the chest area. Wash your hands thoroughly and put on gloves. This must be done before any waxing service. Following the manufacturer's instructions for pre-treatment, remove makeup, oils, and pollutants, as they can prevent the wax from adhering. Use makeup remover or a manufacturer's recommended product. You can apply a thin layer of pre-wax oil to the upper lip and lower lip if necessary to protect the skin. It should absorb quickly and not leave an oily residue. When using hard wax, be sure to follow the manufacturer's directions for heating and temperature requirements. You will want to stir the wax regularly. Prior to applying the wax, always be sure to test the temperature on the inside of your wrist, discarding the used wax or wax strip in the trash can. Wait, don't forget about the double dipping rule. Never double dip a spatula unless you're throwing away the pot of wax afterward. Use new spatulas for each dip to avoid contamination. Okay, let's get started. Using a medium applicator, apply the wax to 1/2 of the upper lip. Glide up under the hair against the growth, from the outer edge to the halfway point under the septum of the nose, then back down in a figure 8 motion. If your client would also like to have superfluous hair removed from the lower lip, the wax can be applied while the first application is setting. If you don't want to distort the hair follicles and the hair is fine, remove with the hair growth. Otherwise, if it is coarse, it can be removed against the hair growth. Be sure to form a thicker tab of wax at the end where the pull will originate. Make sure the wax is firm and tacky, but not hard or brittle. Remove the wax by holding the skin taut at the start of the pull and quickly pulling parallel to the skin without lifting up. Immediately apply pressure to the waxed area to ease any discomfort. Repeat the process on the opposite side of the upper lip and the lower lip as needed. Be sure to avoid getting wax on the delicate skin of the lips. If wax does drip onto the lips, remove it quickly using petroleum jelly or wax-removing lotion. Apply a wax-removing soothing lotion or antiseptic. If the treated area is puffy or red, gently apply aloe vera or a manufacturer's recommended product. You can also offer your client a bag of ice or cold stones to ease the sensation. If your client should develop hives, advise her to monitor the duration, as this could be a sign of an allergic reaction to the type of wax used. If the hives are temporary, she may wish to take an antihistamine before future services, as this could help alleviate the reaction. With the waxing portion of your appointment complete, remove the headband and drapes. Remove gloves and offer your client a handheld mirror to view her smooth upper lip. Be sure to let your client know that temporary redness and irritation are normal. Advise her to avoid sun exposure and tanning booths, exfoliation, creams with fragrance, or other ingredients that may be irritating. Also avoid excessive heat, including hot tubs and saunas, for at least 24 to 48 hours after waxing, and especially if any redness or irritation is present. Always thank your client with a smile and invite her to schedule her next appointment for a month to 6 weeks to keep that smooth upper lip.